Experts, intellectuals, and bureaucrats in Washington, D.C., have taken a calculated hit with each of Trump's most controversial cabinet nominations. However, his most daring effort at dismantling the establishment thus far was to appoint Robert F. Kennedy Jr., a conspiracy theorist and vaccine skeptic, as Secretary of Health and Human Services. Kennedy Jr. was allowed to go wild on health and medications. In the long run, the nation and the globe may be affected by the president-elect's prior choices for Defense Secretary, Attorney General, and Director of National Intelligence. But for the majority of Americans, their impact would be far off. The lives of millions of Americans could be more directly affected if Kennedy, as the nation's top health official, had the chance to reiterate his previous assertions that vaccines are not safe and effective, or to implement his plan to dismiss 600 employees from the National Institutes of Health, which is responsible for numerous aspects of health research, including vaccines. If his suggestions reduced vaccination rates in the United States, for example, many lives could be at danger. Among Kennedy's opinions that are well received by doctors are his demands that school lunches no longer include processed foods, and his accusations that the food industry is promoting items that exacerbate the chronic disease epidemic. However, a fresh discussion regarding the possible practical consequences of the upcoming second Trump administration is likely to be sparked by the decision of the president-elect to appoint RFK Jr. to oversee the health of 350 million Americans, even though his views on vaccines go against the scientific consensus. An ex-president who is still bitter about the institutions and organizations that he says undermined his administration provides the greatest explanation for some members of Trump's MAGA dream team. A Trumpian drive for revenge is just one explanation for Kennedy's rise to power and seemingly lengthy political leash. It may affect the foodstuffs that people consume, the medications that people use, the treatments and drug therapies that are authorized, and the vaccines that people use to prevent diseases like measles in American schools. The head of the United States Department of Health and Human Services, HHS, has tremendous sway over the data available to the public and their decision-making processes. If Kennedy takes office and another virus or bacteria creates a global outbreak during the next 4 years, he will be responsible for containing it.